Let me tell you about something that happened sort of behind the scenes at the Rachel Maddow Show this week that has been interesting. Earlier this week, this happened over the course of a few days, but by earlier this week, we obtained a whole bunch of internal emails from a VA medical center, specifically from the VA Medical Center in Minneapolis. And what was interesting to us about those emails and why they were provided to us is that they showed that the levels of PPE and other necessary supplies for the people who work at that facility, things like disinfectant wipes and hand sanitizer, it showed the levels of those things currently in stock at that VA facility. To show you what I'm talking about, here's one of those emails. This one is from this past Wednesday. And as you can see, the little graphic here in the email shows the current PPE status of each of these items. Face shields, 30-day supply. Gloves, 30-day supply. It also looks like they're good in terms of masks needed for general use, 30-day supply. But then look at this. Hand sanitizer, 0 days of supply on hand. Oh. Same thing with hydrogen peroxide wipes, 0 days of supply on hand. Germicidal bleach wipes, 1 day's worth of supplies on hand. In terms of goggles or safety glasses, that's also very bad. Looks like they have a total of a 4-day supply of those. Again, this is an active VA medical center that's serving lots of COVID patients. And the through line is pretty much the same in each of these emails that we obtained. It shows there being very little hand sanitizer and very few disinfectant wipes in stock. This applies whether you are looking at the supply chain emails from April or from the beginning of this month or even from this week. Now, on Wednesday of this week, we tried to report on this story. In so doing, we reached out to the Department of Veterans Affairs for comment about what was going on with PPE supplies at this VA medical center. And a public affairs officer with the VA responded just before we were due to go on the air with this, quote, "You are misinterpreting a routine email on supply levels." He added that the VA Medical Center in Minneapolis is always stocked with hand sanitizer and has always been stocked with hand sanitizer. He said they have dispensers mounted throughout the facility. He also says that employees have access to all the disinfecting products that they need. Sort of a strong pushback from the VA on that. And that might have sort of been the end of it, had it not been for something that happened today. Because today we received yet another internal email. Today, we received a copy of the new supply email that is being sent out to employees at the Minneapolis VA Medical Center. And this one is different. As you can see, the old email used to break out the various disinfectant wipes they needed for working at that facility. Hydrogen peroxide wipes, germicidal bleach wipes, Super Santa wipes. But now, as of today, after all of that reporting earlier on some of those stuff being completely out of stock, now the email just says disinfectant wipes. Can we drop the bug there so you can see that in the lower right-hand corner of the screen? Can we drop that? Yeah, all right. Yeah, now they're just lumping them all together. Thank you. Because, of course, when you lump them all together and you just pick the one for which you've got 12 days supply, the situation doesn't look that bad. As you can see, the email on Wednesday also showed that VA Medical Center had 0 days worth of hand sanitizer in supply. But as of today's email, they say they have obtained a 20-day supply, which is great. Good for them. Changing what you release in terms of information about how bad things are doesn't actually change how bad things are in real life. And it would be one thing if this was a one-off from the VA, right? If they had earned a reputation of giving it to us straight and this was them kind of getting woolly in this one VA medical center on this one sore subject. But the VA has not been straight with the American people and even with its own employees at any point throughout this crisis. Here's another example. The Department of Veterans Affairs is now pushing to resume regular operations at its medical centers. That would mean expanding medical services and offering certain elective procedures. Given that, and given the repeated reporting about a shortage of necessary supplies for health workers at various VA facilities around the country, VA healthcare workers have actually been demanding that they should get hazard pay, given the additional risk that they're taking coming into work right now. VA, for its part, says that hazard pay is totally unwarranted. And you might expect them to push back on something like that. They don't want to spend extra money on their employees, no matter how hazardous their work is right now. But look at the statement the department's press secretary put out about it. Look at this. Quote, hazard pay is to compensate employees when risks cannot be reasonably mitigated and employees cannot be safely protected. That is the opposite of the current environment at VA. But don't ask us about those germicidal wipes and the fact that we don't have them anymore, or we'll just stop telling you that we don't have them anymore. It does not seem like the VA is getting their money's worth in terms of their spokespeople right now. Or maybe they are. Maybe this is what they were going for. But Baghdad bobbing your way through this part of the crisis is something worse than embarrassing, right? I mean, the truth will out. We will ultimately learn what's going on. And then all your happy talk about it will become, at best, embarrassing and at worst, indicting. I mean, listen, I believe that VA medical staff are doing their absolute best. If you meet someone who tells you they work at a VA medical center, your first instinct likely is, and definitely should be, to buy that person a beer, or at least shake their hand. They are doing a great public service by doing that kind of work. But the agency itself and its leadership and its spokespeople in particular are not doing themselves any favors by pretending that everything's fine. In the VA right now, this is the largest medical system in the country, right? It serves this incredibly vulnerable and valuable population of Americans who have served their country, most of whom are over the age of 65, who depend on the VA for directly provided care. It's the federal government's direct responsibility. They need to get this right. Happy talk that the problems don't exist in the VA is not a way to make the actual problems in the VA go away. It's not a way to get help for those problems, for sure. I mean, hello, VA leadership. You are not alone in having a hard time handling the challenges of this epidemic, including keeping your medical staff protected with hand sanitizer and germicidal wipes and all the PPE that they need. You are not alone in having these problems. It shouldn't be embarrassing to you that you are having these problems. If you tell people the truth about what problems you are having, you'll be a heck of a lot more likely to get help in trying to meet those challenges. No one is looking to blame you. We want you to succeed. When you lie, you make it hard to help you succeed.